Hello Pilates and yoga lovers, welcome to my video 5 of my free 6-part video series about my core and back immersion therapy where you can regain life without back pain. So make sure you watch the first 4 videos first before proceeding to this video. This is my puppy Abby. I just have her a few months ago after I lost my dog Abel. And this is her first video of the year and my first ever in my channel. So let's discuss about, do you want to know exactly how amazing transformations and restorations from back pain will be the topic of this video, a discussion of actual case studies of core and back immersion therapy. In the last 4 videos, I covered a lot of groundwork, so make sure you watch those 4 videos first before watching this video. You can check out the link here or in the description before, because I covered a lot of groundwork. I showed you how you can quickly get started using core and back immersion therapy. And we walked through the roadmap to recovery. Do you want to see exactly how amazing transformations and restorations from back pain will be the topic in this video? And I will be discussing actual case studies of my fresh graduate students from a core and back immersion therapy. So there's going to be 2 students that you will see their testimonies on how they recovered from their back pain and chest pain or whatever situation they have. In the last 4 videos, I covered a lot of groundwork. I showed you how you can quickly get started using core and back immersion therapy and start rebuilding your life already without the back pain, have a stronger core and overall posture. Then seriously, don't miss this video. This is my puppy Abby. She is 9 months old. This is her first video on my channel. I lost my dog Abel last year, summer of 2022, and that's why you haven't seen Abel in my channel. You can see Abel in my other videos. It was heartbreaking losing my dog, and now I rescued Abby at Austin Humane Society, and I'm blessed to have her, and I'm slowly recovering with the help of Abby. So thank you for those who've been asking, where is Abel? So in this video, let's moving on forward. After introducing Abby, let me introduce now my students who recovered from back pain. You'll be able to watch one of my students who finished my back masterclass, and one of my students, her name is Olgisa. She's from Oslo, Norway. She's actually a medical doctor, ophthalmologist, who is suffering from right quadratus lumborum pain. So if you notice, I have a quadratus lumborum videos that you can check out on my channel. And I have a lot of subscribers who are benefiting from my video. And she found out my channel because of that video, and she joined my back masterclass. She hurt herself from doing a hip thrust workout with 70-pound weights gym routine where she felt a pop on her back, and since then, last year, January, she was having debilitating pain. She was unable to go back to the gym. She is so unsure of herself. Her confidence went down, and she went to a lot of physical therapists, 6 physical therapists who told her just work out, it's just stress, and everything felt the same pain. She went massages, acupuncture, and she doesn't know what's the root of her problem. And through my workout routines, after seeing her with my Zoom meeting calls and guiding her, checking her MRI, checking her posture, I found out it's not just a quadratus lumborum situation, it's actually the weakness on her glutes and her SI joint. In my assessment, I found out a lot of things that she never heard about. I gave her a lot of amazing tips, and now she felt so much stronger, a stronger core and back, and now she knows what to do to slowly build up safely and effectively before going back to a higher impact workout. And because of her work, where she requires a lot of sitting, standing, and walking, and sometimes she works 19-hour shifts, she found out how to recover now and how to take care of her spine, to listen to her body, and how to get back to 100% health. Even though it's a slow process because it's been a year, almost a year of back pain, I guided her safe and effective routine on how to finally fix it. So please watch Olgisa on this video. Let's introduce again. Hi, my name is Annie, and welcome to my channel, Annie Pilates Physical Therapist. I have my lovely student, Olgisa, who is from Oslo, Norway, a medical doctor who has been suffering from low back pain on her right glutes. That started from doing a hip thrust in the gym, and she tried many therapists already. And let's discuss it and introduce Olgisa.
Hi. Yeah, I've been having lower back pain and on my right side for about a year after a gym injury, as Annie said.
And then how do you find my program so far? I know you've been attending for, right?
7
7
weeks.
weeks.
Yeah. It has been very nice, good follow-ups weekly, and I like very much your videos. So easy to follow and gentle for the body.
Good.
Mm.
And as you said before, you tried like acupuncture, massage, and even different therapists already, like at least 6 therapists, you said? Is that
Yeah,
true?
something like that.
And with those therapy, no one really helped you, right? Like finding out the root of your problem.
Yeah, so I didn't get much better, or I got a little better, and then again in pain, and yeah, I didn't really find a good routine.
And then with this program, you found out what works for you, what exercise program, right? So far, what's your favorite workout that you feel best on your buttocks area and your back pain?
From your program,
Mhm.
I like the clamshells and the band workouts. Mm.
And then because of this program, what diagnosis that you found that you never found out, right? Since we've been analyzing is the SI joint, right?
Yeah,
The
that's what we
sacroiliac
think
joint.
it
And
is.
she's a
Mm.
medical doctor, not realizing that she could have it because you can go to a therapy place and just a mediocre therapy just saying work out, right? Working out
Mm.
only doesn't solve the problem, right? You really have to
Mm.
find the root of the problem and what causes your pain. And so far, you feel confident on what diagnosis you have, right, Olgisa? Like it's almost like a hit and miss on other therapy. And here you
Mm.
found out how to strengthen your core safe. So this is how I
Mm.
guide my patients on my program. We discuss how they're feeling. We monitor the posture first in the beginning, and then we progress. And I'm glad you enjoyed my program, Olgisa. Anything that you want to say to my subscribers that you want to share with your journey with me, even though it's online, even though I did not touch you, even though um, all I did was just listen and take history taking, right? And really
Mm.
follow through the program.
Mm. No, it has been very nice, and you're listening to your patients, and I'm very happy with your program.
That's good. Do you think this is a good program? You can recommend some of your friends, loved ones that will benefit from this?
Well, if they get as unlucky as me, then injure themselves, definitely.
And what's your goal, Olgisa, to go back to the gym, right? And start
Well,
lifting weights
mostly, no, mostly just to live pain-free life,
to be pain-free
actually.
life.
Yeah.
I know that's a big goal,
Mm.
but we're getting there. We just have to be patient on healing. But I'm glad that you're seeing some strength and then how to control your pain and how to live like because this is a lifestyle that slowly you're learning more about
Mm.
back.
Yeah.
Okay. Until my next video training. I'll see you again my next Zoom meeting, Olgisa. Always remember, be
Yes.
safe, be well, and healthy you.
And another testimony is from Imogen of Alberta, Canada, who was my student last year from my back, who was my student 2 years ago for a back pain, and now she's coming in from a different condition. I fixed her back pain 2 years ago, but this time she experienced costochondritis, a pain on her chest that she doesn't know why it started after a chiropractic treatment. She went to a chiropractor to fix a left scapular pain, and after some manipulations, she ended up with chest pain. She thought it was a heart condition, which is one of the signs that people thought it was a heart problem or a heart attack. She went to the hospital, did all the tests, everything was negative, which is great news. However, she was in debilitating pain. She was sleeping on the recliner, taking strong pain medication without any relief until she called me back. She asked me for help. She went to Instagram, back in my Facebook page that you can check out also, and chatted with me. And I just, perfect timing, I was reopening my back masterclass date last year, and she joined. And finally, in a span of 1 week, the sharp pain that she was sleeping on the couch taking strong pain medication, she was slowly recovering. She was able to go back to bed, sleep in the beds, have better sleep, wean off the opioids that she was taking, strong pain medication that didn't give her any relief. But with my gentle guidance, I was able to fix her costochondritis. from not able to lifting her arm overhead to slowly lifting arm again and able to recover 100% without pain on her chest in a matter of few sessions on therapy through my back masterclass. So I'm super excited. I'm with full of emotions because this is going to be the best neck, back, and posture therapy masterclass available utilizing Pilates, yoga, and physical therapy, evidence-based practice fused together the core and back immersion therapy. So watch Imogen here to watch her amazing testimony. I'm here to interview one of my lovely students who is an amazing student who recovered from her costochondritis and mid-scapular pain, as well as slowly recovering still from her SI joint dysfunction with low back pain. I know she has a lot of areas trying to decipher the code, but in the short span of 8 weeks, from excruciating pain, lack of sleep, taking strong pain medication, and been sleeping on the recliner now. She's sleeping now in her bed. The pain is very dull now. It's almost reaching to the goals to be able to be active again. Let me introduce you to my lovely student, and her name is Imogen Stevens. Hi, Imogen.
Hello, Annie.
How was your experience with my back masterclass program?
It was very good. I decided to do it again because you helped me so much the first time, and you really helped me this time getting rid of the, I can't say that word,
Costochondritis.
Yes. That was very painful. And I was just at a loss. Well, I actually didn't know what had happened to me. So you explained it really well, and you helped me get through that. And I know that I have to keep working on my hip.
And then can you experience and tell to my audience what happened, why you experienced this costochondritis? What did you do that caused this problem?
Oh, well, I went to the chiropractor, and who I've been going to for years. He's a very good chiropractor, but he decided to try to put my rib in a different way. And when he did it, it just kind of popped. And I didn't feel any pain for a couple days, but then after a couple days, I actually thought I was having a heart attack. I went to the hospital. I had my heart checked, and they said no. And then I started looking online, and I got in touch with you. And I guess that's one of the first things you're supposed to rule out is your heart. And then there's different methods that you helped me to. So I didn't get sore yet to free it up, I guess.
And
Yes.
how long you have this excruciating pain that it felt like a heart attack? How long were you having this pain, and what kind of pain medication were you taking to to slowly help the pain? But it didn't help at all, right?
Well, I have hurt my back, like, overdoing it before, and I tried Rebecca-set. So I tried that, and I was taking 2 every 4 hours. It wasn't even touching it. I did find that after ibuprofen helped, and I could take one of those like every 12 hours or 8 hours or something. But and I'm not a pill pusher. I hardly even take an aspirin. So, but it was a very painful experience. I like chiropractors, but I don't think I'll go back.
Especially with that experience of releasing your upper back and resulted to your inflammation on your costochondral joints, as I explained from my previous videos as well about costochondritis. And I'm glad only even online communication, I was able to diagnose you and really fix the root of the problem, because from taking strong pain medications for more than a week, right? Sleeping on the
Yeah.
recliner, putting some ice, putting some heat, and with my guidance, finally, you could sleep now, deep breaths without pain, and you can lift your arm now, right? It went so bad, you
Oh,
can
yeah.
even move your shoulder.
Yes, it was painful, and I'm very thankful, Annie, and I will recommend you to everybody.
Thank you. I'm glad that even in a short amount of time, even in just 2 weeks, right? You were slowly seeing results.
Yes, and I sure would not want to leave that go and help and let it become a chronic condition because it's painful.
As I discussed about costochondritis in my other videos, it could last up to 2 years or more, and you can be stuck with that sharp pain stabbing on your chest. Can you imagine having that pain and being on your strong pain medication without any relief? That's terrible life.
Yes, and and the pills are just going to wreck your liver and stuff. I mean, that's not an answer. So yeah.
Plus, you were not active. You weren't able to go back to your previous lifestyle. And now, with your pain on your costochondritis is not there anymore. It's so minimal now, right? It's just healing slowly. It's more
Yeah.
just tightness now, right?
Yes, yes. Well, before I couldn't even, I tried to do a rollover on a stability ball. I couldn't even do that, but now I can even lay on the bolster and yeah.
That's
So
amazing.
thank you.
I'm glad that you're slowly getting there, even in short 8 weeks, and you have limited access, unlimited access on my back master class. I'm sorry, it's not limited, it's unlimited. And you can
Okay.
always go back to those exercises so you know what to do just in case something happens. Hopefully, no more, knock on wood.
Okay. Thank you.
Thank you so much, Imogen, for your lovely testimony on how you recover from having this costochondritis, mid-scapular pain, as well as your back pain with hip pain on your right side. So if you need any help and support from me, I'll be reopening my back masterclass by January 21st, 2023 for those who needed an extra help and guidance from me so I could find the root of the problem, right? That's the key. Oh, that's the key, finding the root of the problem. Because if you
Yes.
don't know what's going on, you won't know how to fix your back pain. And if it's more than a month, it's already chronic, and we don't want a chronic situation that's going to be harder to fix the longer you have the pain. Okay, Mojin, thank you so much for joining my class and wish you best of health and always be positive, encourage, and healthier you. Until my next video training, always remember, be safe, be well, and healthier you. Bye. So I'm glad that you feel good, Emoji, and I'm so proud of your progress.
Okay. Well, I thank you, Annie, for helping me because I mean, when you live in a small town too, you don't have a lot of resources. And you know, the fact that you're able to help me just by interview is really something. Yeah.
Knowing the history taking, right? Like someone
Mhm.
who listens and really follow through, knowing with 20 years of experience, I've seen it all. So that helps me diagnose you, even without touching you, which is amazing,
Yeah.
right? Because that's
Yes.
the
Yeah.
key. All you have to know is to do the right, because therapeutic exercises is like medication. It's amazing. Through movement patterns, you can heal
Mhm.
without
Mhm.
any massages, without any pain medication. I didn't even have to touch you, and you see results.
Yes. Yeah. Okay. Thank you.
Thank you. I'll see you next week. Give me a text when you're settled down, even just for a quick goodbye.
Class, my Core and Back Immersion Therapy. I am so overwhelmed and so excited to meet my new students. I've been receiving a lot of emails already for those who are already in my waitlist. There's at least 10 people signing up every single day for a first come, first serve basis because I'm only going to admit a very small intimate class so I could guide you 100%. So if you're really interested to have a stronger core, improved posture, click the link on my description below and be part of my early bird waitlist as I reopen my back masterclass. Because through this, I can't accept everyone. I'll be giving a ton of support and attention to every single student, patient, and client, and therefore I can only work with a handful of people. I'm planning to only accept 20 students, and after that, the class will close. I can't admit more than that because I want to be 100% to each of my students. So if you're serious about regaining life without back pain, with a stronger core, improved posture, and to have an overall flexibility and mobility of your spine to get back to your previous life, join my back masterclass. If you have any questions, suggestions, or concerns, leave a comment down below or direct message me on my social media and try my best to answer each one of you. So make sure you keep your eyes peeled for my next video. Video 6 is coming up to learn more about my back masterclass. If you have any questions, suggestions, or concerns on how to join, because I'll be sharing some very important instructions on how you can secure your spot. So when you sign up with your email and your name, you will receive email from me on how to join my class. So if you missed some of this amazing progress already, make sure you start on my video 1, 2, 3, 4 and learn more about my Core Back Immersion Therapy if this is right for you. I'm hoping you enjoyed the lovely testimonies that you watched today. It's been a great journey. I have a lot more students who are also left a lot of amazing reviews on my back masterclass. So watch here for video 2 and 3 and click here for video 6. Until my next video training, always remember, be safe, be well, and healthy you. See you in my next video. And Abby say, bye!